Assalamu alaikum. Hi everyone. In this video, we'll be talking about the basics of folic acid supplementation and why you need it for pregnancy. Pregnant women are always encouraged to take folic acid supplements, and most women are given folic acid supplements after meeting the doctor at the beginning of their pregnancy. But why is it so important? Let's start off with the basics. What is folic acid? To understand that, we need to understand the difference between folate and folic acid. Folate and folic acid are two forms of the same vitamin, vitamin B9. The difference is that folate is the naturally occurring form of the vitamin, so this is found in foods like green vegetables, liver, and legumes. But folic acid is the synthetic or the man-made version of the vitamin, and this is the form used in fortified foods, and our main focus today, folic acid supplements. So why do we need to take folic acid? First off, folic acid is needed for DNA replication and making new cells, like brain cells and blood cells. During pregnancy, you need even more folic acid to support both yourself and your growing baby. Not getting enough folic acid can cause abnormalities in both the mother and the baby. For the baby, folic acid supplements help prevent birth defects like cleft lip and palate. It's also shown potential in preventing growth retardation and stunting, which is when a child is too short for their age. Mainly, however, folic acid supplements are prescribed to help prevent neural tube defects. The neural tube is what would grow to develop the baby's brain and spinal cord. Neural tube defects are basically caused when the neural tube doesn't completely close the way it should. Depending on the location of the opening, it leads to different conditions, like spina bifida when the neural tube isn't closed at the bottom. This leaves the spinal cord unprotected and it protrudes like you see here. In anencephaly, it doesn't close at the top. This means parts of the brain and the skull do not develop properly, and babies with this defect are unable to live. NTDs develop very early in pregnancy, during the first 3 to 4 weeks. This is a time when most women are still unaware that they are pregnant. So when should you take folic acid? The answer is before conception. You don't need to wait until you're pregnant to start taking folic acid. Official recommendations say to start about 2 to 3 months before pregnancy. But because most pregnancies are unexpected or unintended, it's important to take folic acid just in case. If you are of childbearing age, or if you're married or planning to conceive and have children, then you can start taking folic acid supplements. In short, start before pregnancy. So how much folic acid? The official recommendation is 400 micrograms per day. This is the amount you would take periconceptionally, meaning before you are pregnant and the first 3 months of pregnancy. Later on in your pregnancy, this would increase to 600 micrograms. Some women with certain conditions may require higher amounts, but this should be discussed with a doctor. So those are the basics of folic acid supplementation. We've covered the what, why, when, and how much of folic acid. Thanks for watching.